Hello, hello. Congratulations. I am so very happy to see you guys here in the Meet for Mrcog Part 3. I told you guys that there would be a time that you guys would be enjoying those moments which we spent on studies. And I'm so very glad that today it's one step ahead. And I'm so proud of you guys. Thank you very much, Negat. Hello, Sarah. Hi, Christina. Hi, Tina. How are you guys doing? So happy to see you guys all here and congratulations once again. Are you guys out of celebrations or is it still the celebration mode going on at home? Yes? Dami, Iram, Hajra. So happy. Dimple, Devi, Uzma, Pooja. Congratulations once again, Zunaira. I'm so happy to see you. Vishali, Preeti. Hello, Sharmila. How are you? Hi, Sarish. Congratulations, my dear. Thank you so much. All right, so we are here to have a discussion on the MRCOG Part 3. Please let me know first your queries, and then I'm going to take it further. Who wants to take in May? And I think many of you have already joined the course. Is it? Yes? Hello. Hi. Congratulations to mommy. How are you, Tina, my dear? Thank you so much. So good to see you, my love. Thank you very much. Thank you for making me proud. All right. Bye-bye, baby. Bye-bye. All right, guys, please tell me that what is the plan and what are the queries? You wanted me to see you guys for the preparation technique and you wanted me to help you with the decision taking. All right, I'm here to listen to you guys. Please, Anjali, what's the plan? Surabhi, I talked to you regarding AOT, right? Yeah? Yes? All right, the ones who have already joined the May batch, please. Can I have them here first? The ones who have already joined the May batch? I have to open the chat box, is it? Thank you, Devi is there. Christina, it's possible to cover everything if you don't have much time. Okay, so I think you guys are not doing unmute. You want me to speak? Okay, so then what I'll do is that I'll join in the session. So that I can open up the chat here side by side. Then I'll be able to talk to you guys. Give me a second. Pooja joined May batch. That's lovely. That's amazing, Pooja. I'm yet to go to the batch, you know. All right. Okay, perfect, Anjali. Now the chat is in front of me and I'm able to talk to you guys side by side. All right, friends. First of all, I have different requirements from different students. Why? Because everybody for part 3 is different. What do I mean by that? What I mean is that if you guys are able to give from this point onwards 6 to 7 hours, it's okay to take May batch. Things are fresh. But then I need total same concentration and looking for the exam content only. I mean, no writer left and no celebrations and no enjoyment because see, people had been studying for May since like 6 months, right? There were students who passed in July 25, July 24, and they took the option of May rather than November. Like many of you are taking the November option, so they'll have 6 months preparation. Are you guys understanding what I'm trying to say? Yes? It's an interactive session, guys. You can unmute, please, and talk to me. It's not our part 2 session where I make you guys mute. You can definitely talk to me and please come up with the questions. So, if you guys are able to cover up everything in 3 months, provided you're very smooth in your spoken, communication is not a problem. Provided you can give 6 to 8 hours, the content I'll make you guys prepare fastly, but you should be able to absorb that content and then you're able to reproduce and present yourself confidently. If you can give 6 to 8 hours from today, I have 120 exam tested stations in regular, 120 in fast track, and these 240 stations are enough, but then you should learn them and know them properly. This is most important. Okay, so the ones who are for May, the ones who have joined for May, I'm absolutely okay for your this decision, but then I need I need hard work more than the November batch, because it would be that feel of like, joining up and be fastly covering up. We don't have time to be slower now. Do you guys get it? Once again, please, can you raise hands, the ones who are in May? Can I talk to you guys? Because then I will see you guys in the study group. How many of you joined for May, please? Can I know how many of you joined for May? See, everybody's circumstances are different. And everybody has got different attire. Nisha did it. Okay, perfect, Nisha. So the ones who have done it, I want throttle. Siti, I want 6 to 8 hours to cover up the content. Pooja, 6 to 8 hours. I know, depending upon the AOT, Surabhi. I'll be very fast because tomorrow I'm taking the session for you guys. It's going to be the first live session for you guys, right? So you should be very clear about that we have less time and we have to compete with those who had been preparing for like 6 months. Do you guys get this point? Everyone? So what you have to do in your study groups, in tomorrow's session, everything would be explained. You would be observing the content and we'll start. So would like to try for May. AOT done, Tina? That's fine. So I don't want this word, Tina, try. We won't try. Then we would prepare 100%. It's not like, half-hearted attempt. It's okay. Just have the taste of exam. No, Tina. We can't have that. If we are preparing, then we will give our 100%.
Yes, ma'am.
Okay. If we have decided, then May has to be a pass attempt. With this feel, we have to work hard. We won't give a half-hearted attempt there.
Sure, ma'am.
All right.
Yes. No, I'll not try. I'll do my best.
You will do your best and then you will see that the result would favor you, because first we have to make ourselves oriented. All right. So the May batch is starting tomorrow, guys. You will understand 110, 111 will be presenting and you will listen to them. You will understand the domains with me tomorrow. You will understand the content with me. In your study group, the introduction would be posted. You will go through introduction and you will write the questions and then talk to me about. All those who have registered, did you go through the introduction or not as of now? Nisha, can you unmute yourself?
Yes, ma'am.
Did you see the introduction?
Yes, ma'am.
Perfect. Do you understand how many stations are there?
Yes, ma'am. For total 14 stations are there.
Very
And
good. How many SPTs? How many structured discussions?
ma'am, structured discussions are 4, and 4 will be with layman examiner, and 6 will be with
layman.
yes,
And 6 alone SPTs.
Yes, ma'am.
Very well done. This is the whole content, and each module has got 1 station. Very well done. So this is the content. What you have to prepare out of that content, you people would be very, very fastly understanding from tomorrow. How the preparation is, I'll tell you tomorrow how you have to prepare the module, because Safa, can I have you here?
Yes, ma'am.
Yeah, which module are they starting with?
This 1112 or 1111, ma'am.
So 112 we'll merge with 111, Safa. Correct?
They are doing, yes, ma'am. Already they are doing this teaching 1111. So
Perfect.
from next, for 1112, we will be starting with the.
So what we can do is that after this, we can have a discussion on the moderator and division of the stations so that they are confident in taking up the
gynae, ma'am, gynae.
Gynac. Okay, that's fine. All right. That's okay. So that's something which we can do it and manage that like. Okay. So you will get the schedule in the study group. Daily, you will post your recording in the study group and you people will have a feedback from the moderator about your performance. You will note down the points where you are mistaken and the correction, because those mistakes I don't want again. After 1 week, you will see me in the live session. Few of the smaller modules, you will see me in 4 days, because we have to be fast to cover up the content because we've got less time. We don't have 6 months, right? So if it is a big module, it will be 7 days. If it's a smaller module, then 4 days. This is 4, 7, 4, 7. Every 4 to 7 days, you will meet me in the live session. And during that time, you will prepare that module. All the recall stations are on your website. Perfectly formed templates. But the idea is to know the content, that if the role player changes some sort of a sort of an expression how you have to deal with that. This is how the practice of MRCOG Part 3 is. And my students are very, very strong in communication. They're very strong in their empathy. The moment they have to enter into the cubicle, I tell them that examiner should be clear that this is a passing candidate. Please, there's somebody by name of iPhone who wants to ask a question. May I know your good name? And you can definitely ask the question.
Hello, yes, ma'am. Ma'am Ishma.
Okay, Shma, my love. Yes, please. Congratulations, first of all, and please let me know
Thank you
what.
so much, ma'am. Thank you. It's all because of you, ma'am. So grateful. Ma'am, I just wanted to ask one question. Ma'am, I'll be continuing my job, but I can easily take out 7 to 8 hours, ma'am. It's not that hectic. My job is not that hectic. So I'm just confused. Shall I take May or November exam? For 3 months, I can easily take 7 to 8 hours per day.
Daily?
Sorry, ma'am?
You can
Daily
take.
you can take out 7 to 8 hours, yeah?
Yes, ma'am.
Okay, Safa, you can go for May
You
then.
can do it.
Yeah, you can do
Yeah,
it.
yeah, she can do for me because
can
you
do-
know,
Okay.
yeah,
This is
there are
only-
advantages. You know, people passing in the Jan when they give
Yes.
in the first attempt, they pass easily with a
Yes,
short time.
ma'am. Okay, ma'am. Yeah.
So May batch, you're starting tomorrow with me, and you have your content ready. The students who were preparing for 6 months, they were revising theory and giving time to that as well. You people have a benefit of your applied clinical knowledge being too fresh, you know? So that content will take less time for you. See, they are preparing the theory for whole day. They read 4 to 5 hours, one guideline, and then they speak. So you guys will take 30 minutes to revise the recommendations, and you will give more time to speak. This is how the difference in preparation is. Ashma, did you get it, my dear? Yes. So
Yes,
this
ma'am.
is
Yes.
how the sequence would be for May batch. And the ones who have not joined the May batch, please, it's already late. Do not, if you are planning for May, you have to start now only because you're already, it's a competitive exam like MRCG2. You have to compete with your colleagues only, right? Later in the study groups, we'll talk about the centers to book. We will talk about the fast track. We'll
It's
talk about
Asmita. Is it Asmita? Is it Asmita or Ashma?
Ishma, ma'am.
Can you spell
Okay,
yourself?
already you are there in
I-
1-on-1.
Yes, ma'am.
You're in the triple one.
Okay, so you know now you are presenting the stations, everything you are following for
Ma'am, I'm
quite
in
long time.
112 group.
You're in 112.
1-1-2 group.
Okay,
Okay, okay.
perfect. Okay. All right. So you have to be active. Nobody is going to just read and say that I've done it. Nobody is going to be hesitant to, post recording. The more you will speak, the more you will learn. And try to face audience, please. Nobody would feel that, no, ma'am, I am so scared of it. I am shy. Nothing like shy exists in part 3. You know how to walk, how to talk, how to sit, how to present. This is MRCOG 3. They've tested you in the part 2 knowledge. Now they just want to see that, okay, the person from head to toe is fine enough to be given MRCOG degree. That's it. So it's how you present yourself, how you explain the things. The theory part has been assessed. Now how you communicate and explain being a patient-safe doctor. This is what I will coach you, and you will find too much of a difference in your preparation after tomorrow's session. All right, okay. Surupi, my dear, you are paying for the November, but please attend tomorrow's session. Okay. All right. So you have to attend tomorrow's session so that at least your flow and speed is this much. And then as soon as we get the AOT reply, we'll just shift you there. Okay. So all those who are for the May, everybody who is for May has registered, who has already registered, right? The May students. I'm talking to the May one now because then I'll start the November ones. Registered? Perfect. Yes. No, if you're for May, my dear, then what are you waiting for? Then, of course, your friends who are starting now, you will be even late to them. You will be late to them because then you will have difficulty in catching up. Manjari Gupta is asking how to register. You guys are not in the WhatsApp group where this thing done, right? Yes, because see, when I have taken the first session, you people will have to cover up that as well. Right, Wajiha? For May people, please don't make it a delay. I'm coming to the November one. Any question? You are there? Safa, can you please post the link for Manjari here? No,
Yes,
you don't
ma'am,
have
I'm posting.
you just have to write to the website team or to me that ma'am, we have paid for the active participation. Put us in the November batch, put us in the May batch. This is from only thing you have to tell to the website team or to the in the group. That's it. That we have paid. Put us in the May batch. See, what is the difference? Content is similar, but May is speedy. I have to cover up everything in 3-4 days, 3-4 days, 3-4 days because you're preparing for May. Same content I have for November, but it's spaced up. I see you guys every 3 weeks for one live session and you get good amount of 3 weeks to prepare one module. This is how it is different. All right. So in 3 weeks, you prepare one module, you get ready for the presentations and then you meet me. It's just that space is more and you get more time to prepare the content. That's the only difference, right? Is there going to be an on-site mock for May exam? Absolutely, my dear. Today is my Mrcog students and we had wonderful, wonderful mock exam, 2 days for Oman. And everything was like, it was like a full dress rehearsal. I'm sure that you are following the Insta stories and students were feeling so much of a thrill, back-to-back circuits, active listener, and I did all the exam stations in the on-site mock. All of you, please, one mock is must. You have to attend. You can attend in India. 3 venues we are having in India. You can attend in UAE, Abu Dhabi, and you can attend in Malaysia. You can attend in London, UK. You can attend in Ireland, right? So these are the centers which we are having. You can attend in Pakistan. Do not miss out. Last time also around 7 to 8 stations were from the Pakistan mock. And we keep all these stations different. And the ones who cannot reach out, please do take online, especially my Myanmar students and my Sudanese who are eligible for taking online exam. We will do complete online exam with all the examiners moving from one to other, because that feel and that fear, I want that before May exam, you pass through them, right? It's a complete Swarnalitha. It is a complete mock exam like exam. And we do multiple. Swarnalitha, for example, you're taking in India, you will take 14 active stations with different examiners. And then you will get the feedback. You'll get your result with keys that, okay, where did you miss that? So that stress level has to be tested before exam. So exam feels like a rehearsal, you know, okay, I've been through. We make cubicles, we make you stand. All these things we go step by step. Manjari, yes, you can take in India. More than welcome, my dear. And if you get UAE as a center, please come and take UAE mock exam. Every time my UAE strength gets filled, last time I had to make 21 cubicles instead of 14 because I had so many students that we made 21 examiners and everybody has to do like 14. So the registrations, they go too high because UAE is a center which like everybody tends to take because of high passing. So we are going to discuss about the centers later. For now, today, are you clear that if you are appearing in May, what is my requirement as a mentor from you guys? You guys are clear on this? Yes? Is there going to be an on-site mock for May exam in Abu Dhabi? Yes, Rema. Yes, yes. In fact, the date is also decided by team. Safa, what did we decide for the date for Abu Dhabi? Rama, you can put down the date and you can book it even now because my Abu Dhabi strength is already 20, have already booked. And I can take, you know, only 14, 28 as active. Then I have to increase the cubicles to compensate for the students. Why? Because the students who didn't get seat in the last mock. Okay, one thing I had to tell you, please. When you book India mock, when you book Abu Dhabi mock, you may book UAE mock or UK mock. If at all you don't get seat, your money doesn't get wasted. So at least please reserve your seats immediately. You pay 150 USD according to the venue as reservation. And in case you don't get seat, that mock payment is shifted to the next. So I have already 25 students in UAE who didn't get UAE last time and their mock payment from November 24 was shifted to May 25. All right, okay. So this payment is a reservation so that we can keep a head count of our active seats. This is for us. But in case you don't get seat, the same payment is shifted to the next mock as reservation. Got it?
Delhi mock will be on 20th April, ma'am.
Yeah, 20th April.
And then 27th we'll have it in Mumbai and 4th May in Chennai.
So actually, we are super busy in the result making at the moment. In 2-3 days, all the posters will be announced. However, reservation link is there. Safa, if you could put all the reservation links there as well, so that at least they can reserve their seats as well.
Yeah, already it is posted in the group, ma'am.
Pakistan
Already
mock,
yeah,
UAE mock. Everybody, you have the reservation links, everyone? Yes, you all have the reservation? No. We have in Delhi, we have in Chennai, and we have in Safa. Put all the venues for Sajmi. What suits them? Sajmi is asking the venues for the India, please.
India, Chennai, Delhi, and Mumbai.
Mumbai also we are doing because we've got massive registrations from Mumbai. Everybody asked for it. So Delhi, Mumbai, and Chennai, right? We are plus minus about Hyderabad. Last time I did that in Hyderabad. But if you guys would be more, I'll definitely talk to India team and we can make in Hyderabad depending upon how many of you are there. So Rabi, I'm taking UK on the next to the Easter week. Easter is on 26th April, right? 20th April, right? So Rabi, see the calendar? Yeah. So we are going to take the next one. 26th April Sunday or 27th April Sunday is UK mock. I've booked already Marriott and we are going to meet in London Marriott. Okay. And already
Exam center
is
exam center actually I posted. Okay, in India it is Delhi and Chennai, then Malaysia, Singapore, and in Pakistan also Lahore is there this time, and then in UAE it is Abu Dhabi, and then UK we have 4 days. Okay, lots and lots of seats is there. Don't worry that you are not you won't be able to book the seats.
So you people should be knowing about this, that in case you people don't get your desired center, you should be able to like shift it to the next mock. And even inter mock also. Last time I remember Diba, she took in daily Safa when she passed.
Yeah, Delhi.
She
Yes, ma'am.
took it
Yeah.
daily, but she booked her exam for the high passing rate in UAE, right? So if finances, they do allow people, we take different stations. At least one mock is must, but you can take multiple mocks. Like she took in Delhi, and then she came to UAE to me, and then she took in UAE as well in Abu Dhabi. So the stations were different. So in this way, she did 28 and 28 exam stations. So she was saying that, ma'am, whole exam was like out of the mock exams only. But that is the final preparation. That is, I always say that mock exam is like, you have to take mock exam as an exam. That thrill has to be there. Even day before yesterday in Oman, I was making them have the stress. I had put laparoscopes, stereoscopes. I had them have this feel, do the breech delivery, because there we have a little more hands-on, is there labor ward prioritization. So I told them, let the throat be dry today, so that you guys have that feel of fear of exam, making the cubicles and passing through, bell ringing, that stress element has to be catered for in the mock exam. That's what we do, and then we give the final results in the keys. Okay. Any questions from the May students? Then I'll go to the November ones, please. Yes, please. May ones, are you guys all set, ready? You guys have moderator there. I will meet you guys tomorrow, all the students, because you guys have to be a little speedy, and tomorrow you'll understand everything about domains, everything about how to prepare, how to be good, what are those points, what is the difference between a passing candidate and a candidate. All those who have registered, please, before meeting me tomorrow, go to your website and do the introduction. Just
So
do
the link posted, ma'am, link posted is just an advance payment. It's not the
it's not
complete
the complete payment, guys. On site, I'm sorry, it's very expensive. We have to do the venue, food, everything. It's not like online. So we do it in 499. And absolutely, Vajiha, we did an amazing mock. If you go to the website, you've got so many testimonials. And we had a very high passing rate mock exam Pakistan. Last time it was in Lahore. This time we are doing in Lahore. Along with that, we might do in Karachi, depending upon the student's requirement. Okay. But Lahore, we have already booked. If not able to get slot in main exam, we have to pay again to get the course appear in next exam. Sharmila, if you're active in May, right? Active seat, I can never transfer because active closes the batch. You can extend like you do in part 2 addendum. You have to extend in 250 USD to the November batch. All right. We can't, because all the content is like website is the cost you're paying now. So you can extend like you do in part 2, right? you complete that and you go there. So the priority booking is for UK who have training number, not the trust ones. The one who have got training number, who are trainees, they get the priority booking. But this time you won't be short of having UK trouble because it's like 4 days. And first time in history, UK is 4 times. Never it's been, I mean, I'm seeing the exam since 2016. Never UK has been 4 times. It's the first time that it's 4 times. Yeah. All right. Okay. Any questions from the May batch, please? Ma'am, please, if you book a mock in UK and we go to UAE for the exam, is it doable? Yes, it's okay. It's absolutely doable, my dear Sarah. I'm going to see you in UK, London. You'll meet me. And then definitely you can do the UAE exam. It's absolutely okay. The content, the examiner standard, I maintain always that. And you find a change after the feedback. And I always get a very good feedback. And I work on that to maintain the standard, Sarah. Yes. So you can meet me in London 27th April. Okay, keep that weekend next to the Easter. You know, the reason was I wanted to keep 26 so that you have around 1 month. But the problem is that on Easter weekend, it's a long weekend in UK and Monday is also then off. So the problem is that examiners and everybody's little, you know, family time. So availability of people was very less. Many of my real examiners of UK, they are not available on that weekend. So I had to put it on the next weekend because of that. All right. We can book the mock here in London. Yes. So Safa, the London link, can you tag Sarah? Thank you so much. Thank you. Sarah, all the advanced registration links are there. And please give Sarah the UK mock advanced registration. You can put it there in the group. All right. And Sarah, I will post you. Then you'll be added. Okay, everybody who is paid for the mock, make sure that you are in the mock group, because they do the head count there. For example, Sarah books for UK mock. Already I've got Christine there. Already I've got Alice there. So when they are there, Sarah will get her mock number. Okay, she is mock candidate number 12. So team knows that, okay, 12th active candidate is booked for the mock exam. See, it's not a group course. Everybody has to present and pass through. So we need to give candidate numbers. So make sure when you do advanced registration, you are in that specific mock group for that center. All right. Yes, Josephine. So I'm taking in Malaysia. I need to take already 7-8 people have registered for Josephine Malaysia, but they are the ones who didn't pass last time. So they have booked the mock. I'm coming to Malaysia either in the beginning of May or in the April. So I'll let you know, and you can book for the Malaysia mock. And again, the group is there. And all my alumni examiners, they are just preparing. It's going to be in Kuala Lumpur. All right. Josephine, we are doing in Malaysia, Kuala Lumpur, and I will be there myself. Okay? Inshallah, my dear. Serish, any mock in Pakistan? I've already announced we are doing the mock exam, and I've already invited the chapter's head, Shabnam, here. Sorry, Shabnam, I was just in the live session, so I couldn't take your call. So I had here, hello, Shabnam, how are you? Shabnam, can you hear me? Hello.
She's joining.
She's joining? Okay,
She's
that's
joining.
fine. Later. Okay. So I actually invited her just because so that you guys are knowing. All right. Has she joined? Hello. Hi, Shabnam. How are you?
Still joining.
Still joining? It's okay. Yeah, just keep on checking. Once she joins, just let me know, Safa. All right. Safa, by that time, can you give the Lahore mock link to Wajiha Alvi so that she at least reserves her seat?
Okay, ma'am. Yeah.
So you guys are all in the WhatsApp group, right? In the result successful students, so that we can put the mock exam links there, right? Okay, I'll tell team to do there. So at least reserve the seat there. Has Shabnam joined? Hello, girl? No, she has just entered again. I think internet issue.
No, she is entering again. Yeah.
No problem, no problem.
Probably she must be in the clinic.
Yeah. All advanced links of mock exam. Put here, please. Malaysia, India, Pakistan.
Yeah, it's
UAE.
already posted, ma'am. Actually, I will send again.
Is it? Okay, okay, okay. So then you can tag them, my dear, because they're asking probably somebody joined late. Yeah. All right, thank you very much. Okay, so all of you, please, for May batch, if any question is there, I'm here to take the questions, please, for the May batch. Tomorrow I'm meeting you guys, don't miss out. Okay, somebody was asking about the session timings. So tomorrow we have 2 p.m. GMT, but I announced the timings as per the schedule in the group. So when you will be in your study group, the timings will be announced in the group also. But tomorrow's session is 2 p.m. GMT. So it'll be okay? Sarish, definitely yes. UAE has got highest.
Exam centers.
Hello, Shabnam is here. Hi, Shabnam. Congratulations for your students. Thank you so much for joining in. We were waiting for you because so many students wanted to talk about the Pakistan mock exam and they wanted to join. So I've given them the links. How are
Ma'am,
you?
Asmita is asking that each mocks will be similar stations. No, dear, it's not like that. You can attend
No.
every mocks as well because it will be different stations in the different
Now,
mocks.
I'll tell you, my
So-
student, if you guys know Soumya, she was our part 1 student, then part 2 student, then part 3, and all 3 she did in year 2024. If you've seen her testimonial, she did in January 2024, her result came for part 1. July 2024, she passed part 2, and November 2024, she passed part 3. And she was like in all courses with RFA. And Soumya said one thing that I took she was in UAE, all the mock exams. What we do is that we sit down, all of us, all the mentors, like Shabnam is here. We have got, Safa as chief supervising everything. Eventually, it has to be approved by me. What we do is that we make all the recalls together and then we make it like 28, 28, 28, and not even a single station is repeated. So if you guys are traveling and 2 venues suit, for example, Sara is taking in UK, then she has to come in UAE, and UAE mock exam is just like 2 days before exam. So people, so many times they take. Felix, who scored 85% in the morning, I received Felix call. He came from Ghana to attend my Abu Dhabi mock, and he was the highest scorer throughout in the MRCT Part 3 exam. So Felix, in the morning, he just messaged me for congratulations for your results, and he said the same, that ma'am, Abu Dhabi mock was like game changer for me. Similarly, in India, students were like,
So-
ma'am, after attending the mock, we get the confidence. So that's something
Pooja,
absolutely.
Pooja is asking we can attend multiple mocks. Yeah, you
Yes.
can attend here. We are starting from April 20th. It is in
Yes.
the Delhi. Then 27th of April we conduct in Mumbai. And then 4th of Chennai, 4th May Chennai. So okay, it's on every Sunday only. So you can
It's
attend.
every Sunday we do. So you can have multiple mocks and every station would be different, Pooja. So every time you will have, so this way, what would you do? Exactly. So you can register to different 3 mocks in advance. You will do, okay, advance payment for 3 mocks I've done. And as soon as you get your seat, and you're in India, so you won't have a problem. This time in Oman, I had 3 students who were in Oman, and there were MRCOT 3 students now. They attended the mock. And there's one student who is for May, but she was in Oman, so she didn't want to lose the chance of, like, she doesn't have to travel, she is in Oman. So there were 3 to 4 students who were not even appearing in today's exam, but they took the mock because they want to have that feel. So this is
Yeah.
how it goes. That
Yeah,
actually,
even the November students, they can attend because if you remember Dr. Sidra and Triu, she was up for the November batch, but last time in May, Hyderabad,
yes,
she came all the
she
way
came.
from Chennai, she came and attended.
Yes, I
So that
remember.
also you can do.
Absolutely. So, Pooja, actually, the thing is that for you guys, I'll meet separately, but you can attend the session, not a problem. For as an observer, I don't have a problem. You guys are part of me. I can be different to the students who were not my part 2 students, but you guys are my family. If you want to attend tomorrow, more than welcome to get an idea, not a problem. But I'll be a little fast and a little rapid with information. So it's just like with you guys, I'll go a little slower to make the basis, like I've got 6 months. Right? Swati, my dear, you have not joined yet? Then you are late, sweetie. You have to, this recording would be uploaded on YouTube as well so that you can listen to it again. Swati, join it today, now only, because I'm taking session tomorrow. Don't be late, sweetie. And Swati, for you, it won't be a problem. I know you. For you, you should get a very high score in part 3. Right? Okay? All right. Okay. So we were talking about the mock exam, Savati. Take maximum mock exams. Safa, you have to keep her place because Namita specially messaged me for Savati. And please keep her active. She will reserve for maximum mock exams. Okay? Right? Thank you
Okay,
so
ma'am.
much. Thank you. All right. So yes, I've explained a lot, Savati, but tomorrow I'm taking a session. This recording would be uploaded as well, like too. Okay. Savati, see, the PLAB 2 thing is a little different because applied clinical knowledge is not there. For this, we have a typical applied clinical knowledge in the words. I will tell you that which words make you pass. You speak this word and you impress the examiner. You speak this word and it's like the key is given there. When you'll attend the session tomorrow, you guys will be so clear that when I make some student borderline, I will justify this one thing made her borderline. This one thing made her pass. This one thing is a failing one, right? So you guys would be very clear on this and you'll understand that. Shabnam, you're able to speak? I'm not sure Shabnam can unmute herself.
Yes, Dr. Sidra, I'm here. Yes.
Hello, congratulations for your students, my dear. We were waiting for you. So, Shabnam, actually, because of the result, there's been a huge pressure on for us from the Pakistan side. Reason for that is that time is less, but they don't want to lose that Lahore center, because they don't want to travel in November. So I wanted to take charge, and I want to introduce that this is the head for the Pakistan chapter, and the most competent, the ones who know Shabnam as a moderator, as one-to-one mentor. They never take anybody else. They always take Shabnam again. But regarding the mock exam, as soon as you register, you'll find Shabnam there and she'll guide you about everything and she'll take your responsibility. So at the moment, Shabnam, we have decided for the Lahore. Many of them, they wanted. If you guys want, we can definitely do Karachi as well. Okay? This depends upon how many registrations they come and she will take the charge for you guys. But please make sure that you guys reserve your seat because again, we would be handicapped if actives are full. It's not a group course. It has to be everybody's place in the cubicles and then candidates. It's same as exam, right? So if exam gets full because people there less, so we have limited slots for the mock exam, please reserve them. If at all you don't get seat, shift that same mock exam to the next one if you don't want to pair. But even then, I will suggest you to do a pair in mock exam because that thrill or that fear, that should be catered for. Okay? All right, thank you very much. Daily's mock, please, absolutely, Savati. Just subscribe now and daily mock is waiting for you guys, not a problem. Still confused about May versus November, which one to opt. So Vishali, in the beginning, I said that if you're able to give 7 to 8 hours in a day, you can attend the May exam. If you can note. Mock in Lahore date, Shabnam, can we finalize for them? When are we planning for the mock exam in Lahore?
It will be
Yeah, it is
around
27th April.
Saturday and 20th is almost 19-20 we will decide accordingly.
Okay. So around, it would be between 20th to 27th April, please. Okay, so that you've got ample time to have a revision and work on that. Daily mock date, please, Safa.
Yeah, it is 20th April, ma'am. 20th April.
Okay, Swati, 20. Got it? All right. Link for daily Manjari is already posted in the WhatsApp group, please. Already
It
posted
is
there.
same link. It is same
Okay,
link for
one more
India.
thing.
For India.
India reservation is the same link. And then you have to, after registration, you have to tell that I have registered and reserved for the Delhi or for Mumbai or for Chennai. Got it? Right? Vishali, it is possible if you can give 8 hours and if you can unmute yourself, I would like to listen to you as well, just to have a little assessment of the communication, my dear Vishali. Can you unmute yourself, please? Can you talk to me for a while?
Hi. Can you hear me?
Hello. Yes, I can absolutely hear you. So can you give 7 to 8 hours in a day?
No, unfortunately, I can't give 7 hours. The
How
NHS
many
job is
hours
quite
can you
hectic.
give for this? How many
So
hours?
maybe like 4 hours or so.
4 hours you can give like judicially 4 hours without any inconsistency?
So we do nights, like 4 nights a week, and then we got long days as well. And I've got like a family at home as well, so it might be inconsistent. So
If I may ask, where are you residing at the moment?
in the UK,
You're
in
in UK.
Scotland, yeah.
England, okay. So you would be aiming for UK center, is it?
Yes, of course, yeah.
And you're in training,
Yes, I am, yeah.
so you will be in a priority, and there's no point that you won't get a seat, Vishali. Yeah, so
Yeah.
you will get a seat 100%. Your seat is already there. So because the students who are in training, they are always a priority. Vishali, it's a very tricky part. But let me tell you that working in NHS, the UK results are hard. But if 4 hours you promise me, I still can take you through that. Take UK mock exam as well, right? It is going to be like around 21 days before exam. So that's like a very good time to even work on the weaknesses, right? And communication is not a problem for you. You know the system. The only thing is that we have to cover my 120 plus 120, 240 stations. Yesterday, I received a call from London, and the student was having the third attempt now. And I had an interview, and I just told one thing, Vishali, that when it comes to exam of MRCOT3, communication gives you an edge, but it's not that you can even get anything and you pass. You need to match the scorecard. What is written in the scorecard, if you're able to utter that in a confident attire, definitely you're passing. So you can do that, but promise me at least 4 hours. I mean, my requirement is 240 stations on your tips.
Okay.
And you can do that.
Okay.
Okay?
Thank you. Thank you, ma'am.
Go for it, my dear. God bless you, my dear. Thank you so much. Thank you. All right. I want to register for 2 places, then how to do that. Manjari, first register for one and then message me. I'll give you again the link, right? You'll register that way. Got it? Okay. Got it, my dear. Thank you so much. Mariam BP, ma'am, please guide. Should I take May? Mariam, you're the same one who is taking the fast track as well, right? The MRCPI. Am I right? You're taking the March exam? Great, Savati. I'm waiting for you. Thank you so much. Mariam, you're my same Mariam who is in the MRCPI as well, right? Are you the same Mariam?
No,
Thank you
ma'am.
so much. You're not same
No,
Mariam?
ma'am.
Okay, where are you residing, Mariam? Where
Yes.
are you from?
In Pakistan right now.
And your concern is about the May Center as Lahore, correct? Yeah?
Yes, madam.
Okay,
Yes,
so
yes.
the only thing is that if you can give me 7 to 8 hours, Mariam, I can definitely help you with this. And then we can definitely take the Lahore mock exam and we can take it further from there. I need more time from you. All right?
Okay, ma'am. Will it be conducted in Lahore?
Yes, yes.
When?
We just announced the date around 20th and 27th of April. We will have a complete mock exam and you will get all the details. You've already registered for the batch, right? The May batch?
No, ma'am. I have not registered right now because I'm confused. Should I take in May or November?
You can give eight hours a day for studies.
Yes, ma'am. I can manage.
If you
I
can manage,
can.
then go for it. Then go for it. Okay? Then go for it.
Thank
Do
you,
it.
ma'am.
All right. But
Ma'am,
please, again, I would not be able to take the May students late because if it's a decision of a May, then you're already late. Then from here we have to pick it up. We can't make it more delay than this because then you're late than even those who are starting now. There were students who started 6 months back and there are students who are starting on the result. There's no point of deciding May after 10-15 days because your every single day counts from this point onwards. Do you guys get it? Then you have to take the November. Manjari, no coupon, it's just a reservation link. Once you get the full link, because you're booking 2 mocks, I will be considerate for you. Okay, Safa, the ones who are booking 2 to 3 mocks, please let me know. We can be considerate for them. Okay, one they can pay full and the second one we can at least give them 100 off. Safa, okay?
Ma'am,
Just-
I have a quick question here.
Okay.
So, they write 2 dates for part 3. So, does the exam happens on 2 days?
Yes, it does. In UK, it's
does.
happening 4 days, Savati. So for example, today, my students have started their exam. 8:30, it started in Oman, day 1. But there are 20-25 students who are taking tomorrow as well. Got it?
No, I mean to say for the main exam because they write 14th and 15th of May
Yeah, yeah,
for part
yeah. Every day, Savati, different students are there because see, it's a circuit, right?
Got
So
it.
when it gets full the
Right.
next day, UK exam is happening all 4 days.
All right. Okay. It's just that when do you happen to have the date? Basically,
Savati,
it depends upon.
when the booking will open for part 2, it's
Right.
different. It's only one date open and everybody is like doing. When the part 3 booking opens, there's a huge table. I've got a picture. When we will be in the study group, I'll guide you about the booking. You don't have to worry. My YouTube
Yeah.
videos are also there. So basically,
Right.
when you open up and sign up on the link for booking, this is how the table opens in front of you, and it says UK day 1, UK day 2, 3, 4 dates are coming here. Book, 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 book like this. Then Malaysia day 1, you know, daily whatever center is there. UAE, Abu Dhabi day 1, day 2. So you have all list here. You click on the book in front of that and you book it. Got it? All days are there.
Got
So
it.
everybody's
Got
going
it.
to
Is that so basically it's just a day's exam. It just happens like when do you get to book your exams?
absolutely.
All right.
And you know the one which will be booked just here.
Yeah.
Everybody, please pay attention here. Everybody would be getting these days, and in front of that, it would be written as sold out. That this day is on.
Ma'am, it's hopefully it's not that difficult to book exam in Delhi, correct?
Daily, it won't be as compared to Chennai, yes, it is. Delhi is a better center. People prefer that. But let me tell you guys, this UAE in 20 seconds gets sold out. So it's like a gamble to book, you know, a UAE.
Singapore as well, right? If it doesn't
Singapore
happen,
also.
you
Yeah,
can always go to Singapore. So it's
Singapore always, Savati, is a very good center. If you don't get India, I will give you, see, center booking is a separate story. After 2 weeks, we will meet. In fact, all the batches I have to take, and I'll give you your 1, 2, 3 of booking. So you don't get 1, book 2. You don't get 2, book 3. So we will decide everybody's 1, 2, 3 as per convenience of traveling, as per, of course, the result expected from those centers. Okay?
Correct. For me, Singapore is not a issue because my brother lives there. So
Oh,
yes.
that's lovely. And that is a very, very high passing rate, Savati. That keep in mind. That has got very, oh yes, better than India. Yeah.
Oh, okay.
If you take,
then.
yes, Singapore. Right?
So I might consider Singapore then. Let's see how start with the studies.
I'll just assess you in 1 or 2 sessions, then we're going to have a chat and we'll discuss the centers. Okay?
Done.
Because I really want that you should be able to do that in one go, right?
Absolutely,
Okay.
yes, we have to.
Absolutely,
Yes.
Sarah. I have discussed already as well in my lots of YouTube sessions. This talk is there. But if you go to my Instagram, go to the highlights of MRCOG 3. You've come out of the highlights of MRCOG 2 now and go to the highlights of MRCOG 3. You guys will understand there. You will see there that centers, they have different types of passing. Out of them, UAE is on the higher side, Singapore is on the higher side. UK is definitely tough, but doable. I have passed in UK center in one go. I'm talking about 2018. So the things are doable, but it's just like you should be able to present yourself. You are competing with NHS candidates, so you should have that standard. In overseas, of course, Arabic students are there, Indian pronunciations are there, so you can merge better with them. But overall, it's all about how you carry yourself, how you speak, and how you touch the scorecard. This is all OSCE is all about. Okay?
So
UK
basically, if I understand, ma'am, that it's more
and I
is the
are tough, both of them.
so basically it's more like communication is the key. If you
Yeah,
have a very
communication is
clear
the key.
how
You
you're about.
know that it's PMS, you know PMS management, but how you express to the patient that how to manage the
Right.
PMS is basically the main thing that you need to
Yeah.
understand.
So it's very much like PLAB 2 as well, ma'am, because they
Yes,
were also
Savati, only the
similar, yes.
content is changed and the paper
Yeah.
pattern is changed, but yes, it is like PLAB too.
It is very PLAB too, yes. They are also, it mattered, you know, you had the examiner sitting next to you and actually assessing you, how your communication, how you are understanding the patient's concern, how you're presenting yourself, you know,
And how
everything
you're
goes together.
empathetic, your empathy is being tested, how you communicate, how you
Yes.
explain, how you use the layman language. All this I'm going to tell you tomorrow, not to worry.
Cool.
So
Sounds
Pooja
good.
says that the examiners in India are Indians or diverse. So in every center, one examiner comes as a representative of UK. Mostly they are Indians and they are from their own places. And I'm going to talk to you about this in the study group further regarding the experiences and regarding the guidance. Okay, only one rep generally comes, maximum 2 representatives. That's rest, it's local only. Okay, all right. Coming to the November students, please. So everyone who is aiming for November has to join now. Why? Because if you guys will be late, then there's no point of not taking May. Do you guys understand what I mean? I mean, if you're squeezing in this long-term preparation to again 4 or 5 months, then take the May exam. Why you're not taking May exam? And if you're taking November for the reason that you've got your chores, you've got your kids, you've got your hospital, you're not getting leaves, or you have your time, daily time spending a little less for studies, then you have to start now because it would be a long-term preparation. So for November students, I need 1.5 to 2 hours daily at the moment. And gradually we're going to increase that together. All right. So if you're making a delay for joining November, then again, you're putting on stress because the long batch is starting this week. Tomorrow you'll get the schedule. Okay, tomorrow you will get your schedule, and when you'll get your schedule, everybody will be starting. Now you guys know from part 2 that when you join in the middle, so much stress is there. Oh my God, they've done this.
From March 1st, ma'am, please.
Sorry, Safa?
From March 1st, we will start the this
Live
November
sessions will
batch.
start. Live sessions will start in the March. However, the daily schedule, or for that matter, the discussions and the preparation of the module, you guys will start early. Okay, so March 1st means that it's just a matter of 3-4 days. Get connected, get settled, and start the preparation now. Last time on the result, we got 4 batches packed with the long batch. So if you do long batch, you should be able to slow and steady stay connected. Don't leave the books because you're in a tempo. If you leave the books, the biggest problem is picking them up together again, because you lose that tempo, and starting from the scratch is always difficult. At the moment, you're in a flow. So start like taking out 1 to 2 hours like a daily routine so that you stay connected to the updates, and you start preparing, you listen to the audios, and you start doing that. Mariam says, ma'am, once we register for May, inshallah, will we immediately get access to the schedule and timetable? Absolutely. In 60 minutes of your registration, immediately intro is with you. Immediately you're added in the study group and the schedule is there. All right. Okay. And the moderator is there to help you guys and to take you further. All right. All those who are in Pakistan, ensure that you guys book for the mock, because the biggest problem, unfortunately, with my Pakistani students is traveling. Unfortunately, for the mock exam, I had 4 out of all the students maximum who could come were having some Gulf visa. The ones who were from Pakistan, despite booking the mock and despite booking the exam, they couldn't reach out. And today they're writing email to college that our visa is rejected. The college doesn't take the responsibility. They are banned to enter into Oman for some reason. So please make sure that you guys do your best. The traveling limitations are too much. And because of that, they really suffered. And I have shifted them today, despite their payment for February exam was there. They were waiting for the visa till the end. So I've shifted them for the May MRCPI mock exam just to compensate. Of course, they are disheartened. They couldn't travel despite getting seat in exam. Okay, so specifically for this, ma'am, is there any center for part 3 in Oman? No, MRCG 3 is not in Oman. Only MRCPI center is in Oman, my dear. Yeah, only MRCPI center is in Oman. And that too once a year. So once a year they do in Oman, but then they don't do it. So next year Oman will be centered again. This was my second mock exam in Oman. Last year also we did in Oman, right? Okay, so this is for MRCPI, but I'm just telling you for the traveling because passport is a problem. So they were not able to travel. All right, so please make sure that you give your best. This is a big opportunity for you guys to appear within the country without traveling at all. All right, any questions, please? So how many of you have entered into the November batch? Next week, I'm going to take your session. And meanwhile, in the study group, you will have the moderator and you guys will start with the intros and the schedule. Love you more, Mariam. Thank you so much. Anjali, ma'am, in November, daily will be centered or not? So this time they've kept, right? Safa, November, okay.
Yes,
We'll get
ma'am.
back to, yeah, look at Anjali's question, please. We'll see last November center, Anjali, and would get back to you on this.
No, ma'am. In November, it is always Mumbai and Kolkata, and in May, it is Delhi
Chennai.
and Chennai. It is
Chennai.
fixed. Okay. Yeah.
So for the last 3 years, it's been fixed, Anjali. After COVID, they didn't change, but still
We have to see.
Yeah, we have to see. This is
Mostly
since
they
the
won't
last 3
change.
years, they always do that because the same committee has to move to the other part as well. So it is going to be Kolkata mostly, and it would be Mumbai. Okay, all right. Thank you so much. Thank you. Any questions, please? So are we guys clear that who are appearing for May, who are appearing for November? Am I clear about the mock exams, how it would be? Am I clear about the regular discussions? Ma'am, if we register for November, you will give us the access from now till November exam. Absolutely. If you are for November, you will tell the group you will be in the November batch. The batch November has access till November. The batch May is still May exam. Okay, then you can extend in case you want. Mumbai, Kolkata, which center is better to book? Absolutely Mumbai. No Kolkata, please. Please, no Kolkata. Kolkata stays available for like 3-4 days after booking. Nobody books Kolkata, unfortunately. Okay, I'll discuss about this in the study groups. We'll have a complete session before booking, don't worry. Mehmet out, are there chances that booking slot may not be available? Sharmila, for certain centers, yes. That's why I always say 1 to 3. One is UAE, second is Singapore, third is Malaysia. So if you don't get 1, book 2, you don't get book 2, book 3. Especially the centers like Kolkata, centers like UK, they stay available throughout. They stay available for like many days because students they don't prefer because of just hard results. So they stay there. It will be first time they are conducting exams, so some chances would be higher. What do you say? It can be vice versa as well, Mariam, because as per nature, it's not very comfortable and supportive environment, unfortunately. So many of my students who are in KSA who are having the Pakistani passport, they still are not aiming for that. They're going for UAE because, you know, the environment might not be. So we can't say until unless we get one exam. It's the first exam. So let's see how it goes. I'll be able to guide upon this after this exam, right? I just had a talk. I was invited on one of the Mariam SOGP meeting, and I just went online and I was seeing all the senior figures out there, but I told them the same that hopefully they'll be maintaining the standards and the things will be fine. It was all about the conference about how they're going to do that, but I was invited as a guest speaker. I just went through Zoom. I was on the projector only, but I gave them my idea. Let's see and hope for the best. It's a good move for all those who have the travel restrictions. Yeah. Uzma Munir, can we join May batch even if you want to take November exam? Absolutely, Uzma. So the ones who want to have fast preparation, they can join the May batch. They can present in the May batch. So this is third set of students who are doing that. Once you do that, access will be over in May, Uzma. Then you have to extend. So in 250 USD, then you can extend till November. All right, as a listener. Got it, Uzma? That's also a possibility. You can do that if you want further content to be fastly with you, right? You're more than welcome to do that. All right. Okay. But then the May access would stay till May if you want to be faster. Then you'd have to extend the content. One more thing, please.
In that time, Usma, you can book a May exam and you can give.
So change your mind after booking, yeah? Sarah, after the session, my dear, I'm getting your messages on WhatsApp. Sarah, after the session, I'll get connected, sweetie. Yes? Okay, thank you so much. Thank you. All right, guys. So any questions, please? I hope you guys are clear. Uzma, if you are taking and finances is not an issue, then take listener for May and active for November so that you prepare now with them and then you present to me in November. So at least I can have a focused idea about how you're doing. What I do for myself as a mentor, I have my notebooks of each active participant. And when I open that notebook, my e-notebook, I tell them that, okay, in the last presentation, this was there. And I make my notes of each active participant and they know that where they're going, which domain they're weak in. And then in the next presentation, I tell them that this is what you have done last time. So please don't repeat this mistake again. Reinforce them because everybody is different when it comes to communication in terms of strengths and weaknesses. In part 3 is different because every student has got a different baseline for the preparation. So again, the stations which we do, again, 120 in the regular, 120 in the fast track, they will be sufficient for you to appear. The only thing you need is to get the hang of the exam and then appear with full confidence. All right? That's really good, Uzma. My pleasure. Then it's really good. If you want to shift it to listener, you're more than welcome. If you want to continue as active, even then you're more than welcome. Right? Thank you, my dear. Please, yes.
Ma'am, I've already joined as active in May, and I really want to do the exam in May.
Okay.
And I'm relatively free that I can really put in 8 hours every day.
Lovely. Lovely.
Except in March, I have like 5 days of like personal commitment where I don't think I'll be able to do it. Is that all right? Just 5 days.
Absolutely okay. You tell me those days as per the schedule, and I'll reschedule your days, and you'll tell me that, ma'am, these 5 days, please. We will not postpone those 5 days, Christina. Those 5 days things we'll do prepone and we'll cover it up so that we are relaxed in those 5 days. Okay.
Thank you so much, ma'am. Thank you.
Most welcome, my dear. Which batch are you in?
112.
112, that's perfect. All right, I'm going to see you tomorrow, okay? 2 p.m.
Yes,
GMT,
ma'am.
please meet me. All of you, please, because of the messages of the results of part 2, part 1, part 2, and imagine my state of MRCPI OSCE today. So I'm getting messages, the ones who are taking the long cases at the moment. I've not been able to come to the part 3 groups. The moderators and the team are settling them. I'll definitely see each one of you and then talk to you. We are going to have a self-assessment. What are your strengths? What are your weaknesses? And you'll find the change in, I think, 1 to 2 days when this MRCPI OSCE, day 1 is today, day 2 is tomorrow, the exam. So I'll be in a better position than Christina like this. Like Christina, if any individual requirement for anyone is there, please tell me separately so that I can make a note of that and we can adjust. Part 3 is all about being one-to-one connected, right? Don't be hidden. It's not like a group big thing. You have to stay connected, everyone. You have to tell me that, ma'am, here I feel I'm weak. This is what happens to me. Literally, students, they message me, ma'am, I don't know, something happens, like my heart starts beating faster. I start sweating. And I tell them, no, okay, this is the thing we have to work on. And I start making my notes. So please help mentor to make you pass, help mentor to make you feel that confidence and energy for the exam, so that unless you guys won't be open to me, you guys won't come up with your limitations, inhibitions, and fears, I won't be able to coach you properly. So you have to help me to make you pass this exam. And I'm sure that we already have a very good rapport building and connectivity. I'm sure that we will be successful with this aim and togetherness, right? When would the fast track be started? And it's India in October beginning, so we'll have family commitments. When asking Samantha, are you asking about the fast track November, or are you asking about the fast track May? Fast track November. November fast track will start
Mostly from September.
September. We always start fast track 8 weeks before the exam, generally.
That is after the exam booking.
So the day exam booking starts, that is the day my starting of fast track. Like this time we are starting on 10th of March, which is the booking. Why? Because fast track students are only those who get the seat, right? I'm packed up with fast track actives already, but anyhow, all of you, please, the ones who are in the regular payment, they get fast track listener in 50% off. Okay. Thank you, Manjari. Love you so much. You've paid for the mock exam, Manjari, or for the regular course? Manjari, regular course or the mock exam, my love? Because I have to reset your mock exam link for the second mock, yeah?
Ma'am, for regular course, I already paid.
Perfect.
And now I paid for mock exam, $140.
Okay, so now the same link you'll do again after 5 minutes, okay? That would be your second mock reservation. Do you get it?
And how much, ma'am? Any coupon and all you were telling me?
In reservation, it will be 140, but in the full payment, when the complete 499 link would be given, you have to remind me, I'll give you off in the full payment. Reservation, you have to do complete, it's 140 only. Okay? The full payment is 499, so you have to remind me, this is my second mock. I will consider that and I will tell team to give you 100 off on the second mock booking. All right, my dear? Okay, my dear. So after 5 minutes, you can be doing the same link again. All right? You can open it up.
Ma'am, what is the date for Mumbai mock?
Safa, take over, please. I'm messaging website team.
27th April, dear.
27th April. And Chennai, ma'am?
Chennai, it is on 4th May.
Okay, ma'am. Okay.
Okay.
All right.
Hello.
Any other questions, guys?
So
Hello, ma'am.
Sarah is asking about one-to-one. So now this question, one-to-one will be after your regular course, before your exams. If you feel that you want to present directly to the mentors, you want to do many stations, that time we will encourage you to take one-to-one with our moderators and mentors. Okay?
Hello.
Yeah, yes, dear.
Hello. Hi, ma'am.
Yeah.
Ma'am, I've enrolled for the May course, but I was a little apprehensive. I understand 6 to 8 hours per day is a must, but do you think it is necessary to increase the amount of time dedicated to 10 to 12 hours in the coming months? Or since I'm in a job with mostly 6 hour shift, so it's okay for me to spend 6 to 8 hours daily. But do you think it needs 10 to 12 hour preparation? Because that was scaring me a little because I cannot be resigning from my job again. I did so for part 2. So what do you think?
Okay,
No,
8
dear.
hours.
Actually, it is
8 hours.
about speaking only. Once you will
Yes,
understand,
ma'am.
you will understand how much you need to speak, and accordingly you can do it. It's not like you have to quit the job and you have to do. So till the exam day, I used to be in my clinic. In my clinic, I used to do practice by myself. So it's not like you have to resign the job. You have to take off and then do. You can do, because this is not like reading all the time, sitting with the reading. It is only listening and it is only speaking.
Correct,
You can
ma'am.
do it.
Correct, ma'am. So consistently 6 to 8 hours is a must and should be doable with that.
That is what I'm doing. Even when you are going, when you are doing your kitchen works, whenever you can listen to the audios. Okay, then you can you can practice by yourself by 10 minutes, 15 minutes, like that. Okay, it's not like you have to quit your job or you have to take off completely for 2 months. It's not like that. Just before exam, like 10 days, if you take off, that's enough.
And I always tell
Okay,
them,
ma'am.
the students who are in the labor suite, I tell them, Manjari, I've got a message from the website team. You can pay on the same link again for reservation, second reservation. Okay, that has been researched for you, my dear. Okay, so
Um,
I'm
Ma'am
thank
Sidra, so this registration that I have done for the premium group, what's the difference between this fast track and premium for me?
What I do is that I do 120 stations in the regular course. And in the regular course, what I do is that I take modules and I cover up modules. For example, we have teaching module, early pregnancy module, we've got gynec module. So I do module-wise recalls. Then we come to the fast track. Fast track, I take 12 sessions, and in fast track, when I take 12 sessions, I take them paper-wise. And I'll start from the recent paper. For example, fast track number 1 will be November 2024, day 1. If on day 1 I have, for that matter, HMB, I would not do that HMB because I've done it in the regular. I don't repeat the cases. Fast track is absolutely different. Regular is, there's no single station overlapping. But fast track is fast. It is paper wise. I complete a paper. So it will include early pregnancy, maternal medicine, gynec, everything, urogyne, because it's in one exam. Then in FT2, I'll pick up a second paper. But what happens is that, for example, I'm doing fast track 2, but maybe I'm doing third or fourth paper. How? Because I take out those stations which I've covered from the regular. I don't repeat them. Got it? So
So
in this,
basically both of them are equally important, so to say.
they're equally important, but the ones who have not taken regular, for them, fast track becomes very difficult because I don't teach module wise. Every module will be mixed. It
Yeah,
is
regular
paper.
course is the basic course. Regular course you can't miss at all. Okay,
Because
that
in
will be
regular
teaching
course,
you how you
and
have to do the station.
if you can take both actives, it's really good. But if you can't take it, at least take 50% off fast track listener. So you get the content. In regular, and for you guys, listener is better. Why? Because you guys are already doing active participation in side by side because you guys are late, right? Starting up. The students like 104, 105 batch, they have completed their regular course. So now they're taking active fast track so that they have the continuity. Do you guys get
So
it?
basically,
You guys would definitely, you guys would be presenting to me in the regular. So in 10th of March, you can just get those stations and merge here. So I'm listening to you. I am connected to you. Okay.
okay. So fast track was basically a listening course, if I understand correct. Is that so?
Oh, no. There are 65 actives already registered in the fast track.
Already registered, yeah.
Packed up in
No,
the
what I
fast.
mean, like, okay, it's also active. It's just the stations would
Every
differ
course
because
is active and listener because people have to present to me, right?
no, that's why I understand. So for me, is like to cover all the stations which are probable stations in part 3, right? So what I
That is
want to understand is like if I'm going for this premium course, like I have just registered for it, if I take upon active course, would I be able to use both of them equally in the similar manner?
Yes, you'll have to do that because this is how the things will go because we've got less time. So you will do a module here, you will attend the fast track and you will listen to that recording in both the courses you'll have to merge because these are stations only, right? So you and I
Right.
saw the station. So it will be sort stations with you.
Ma'am, and we are
Ma'am,
restarting. It's just 8 weeks to be very honest. It means 10 weeks to be very honest, very clearly, before the exam. So fast tracks also starts to for 8 weeks
10th of
before,
March.
as you mentioned.
March,
End of
mhm.
March you start. Okay,
10th
so
of
it's
March.
basically
10th of March.
10th of March. So basically both of them would coincide. Would I be able to do it,
For
do you
you guys,
think?
yes. We have to cover the stations. We can't leave 240 stations. That's what I'm saying. Why I'm asking for 6 to 8 hours. This is the reason. The other students who are done with regular, see, my November batch started from 104 till 103. They appeared. The May batch started from 104 till 103. People have appeared in November. So 104, 105, 106, they are done with their regular courses because they started like November students are starting now. See? So
Right.
they started 6 months back. So they're done with their regular course. Now they're doing fast track active. So they know that content. For you guys, that's the reason I'm saying that the ones who are in May, I want speedy preparation. I want more time because the content we have to cover. We can't go half-hearted. So there are
That
two
I would
40.
manage. I think I would be able to manage that time because if I want to do it in May, that I need enough time on my hand to make sure that it goes in a go. It's just that I just wanted to understand that fast track, would it be any different? Like part two was quite different, ma'am. So that's why I wanted to
Absolutely.
understand
Part
how it is.
three fast track. I'm telling you that my bookings, they get like 4 5 months before. I'm telling you that today I've got 60 plus actives. And we're just waiting that maybe, they get if anybody doesn't get seated, they get shifted. So fast track gets booked very fastly because they know that the way I do the fast track is like just exams. So it's like the same exam feel in the fast track is there. But the regular makes your bases. You guys are new. I need to work really hard to make your bases strong because each module I'll pick up and, make the bases out of that module. All
Ma'am,
right?
I have a doubt,
Okay,
ma'am.
can ma'am so send me the link
Ma'am?
for the fast track too.
Sure.
So I'll start it with both of them simultaneously.
Absolutely. Absolutely, Ms. Swati. I'll send you that. Yeah.
Ma'am,
All
I
right.
have a
Perfect.
doubt. Ma'am, this November batch, ma'am, usually the sessions will be at what time, ma'am?
Vinny, I'll ask you guys in the group, whatever you guys together say. At times, if it's a consensus, I keep that time. If there's no consensus, like half of the students are saying morning, half of the students are saying evening, Vinny, then what I do is that I do it one session at 2 p.m., one session at 10 a.m., depending upon what students they say. The MRCG 3 is like 18 actives, right? So I always consider what they are happy with.
And
Okay?
each session will be around?
3 hours I prepare, but at times many the students, if I'm not happy
extends.
with the presentation, so I have to do all like the pattern happens is like first I give 2 minutes of reading time, they read it, then they present. So either if it's a difficult role play, I do myself, or I tell a student to do the role play, I give the instructions, and then you do the role play. After 10 minutes of presentation, I give the feedback. But then if I'm not very comfortable with the type of the presentation, because it goes into the recording, then I do the complete station myself. So you guys get it in the recording and later you can go through it. Okay, how ma'am did this station. So it prepares your content completely. Then we go to the next. And each session for each module, I do at least 8 stations. So
Ma'am, and
I
both
prepare it for 3 months. I prepare it for 3 hours, but at times it happens that it gets like 4 hours as well, 3 to 4, depending upon the queries. Especially the initial few sessions get longer because I have a lot to give a feedback. But gradually, I feel that it goes to 3 hours when you guys get a little better. Okay.
Ma'am, both active and listener, both will be simultaneously listening to the class.
So, for example, you all are here. So, Vinny is active, Manjari has paid for active, Savati has paid for active, Aparna has paid for active. So, actives have their schedule of presentation. Team puts that, that Vinny is C1, Hadia is C2, Manjari is C3. So, your presentation is today. You present the case. Listeners, they are quiet and they just listen to the session.
But
Only
it will be like in the live session only, they'll be listening.
Yeah, in the live session.
Okay.
Yeah. And the recording also uploaded for them, but they won't be able to present to me. They won't be able to get the feedback. Not
Understood,
even this, they would not be able to get feedback in the group also. Because actives, they keep on posting their recordings daily for the moderator also. I mean, daily they can post their recording and daily they get the feedback. They get prepared for the session. Listeners, they don't. Listeners
They
are
don't get it. Okay.
no. They don't get any feedback. That is the difference between, of course, the registration and the seat. Listeners are
Okay. Okay.
they're just observers. Okay, listeners are observers only.
Good morning, ma'am.
Okay, ma'am. Thank you so much, ma'am.
Thank you, my
Ma'am,
dear.
good
Yes,
morning,
ma'am.
ma'am.
Good morning, Anjali. Yes,
Yes,
ma'am.
I just wanted to say thank you to you, ma'am, for you and Dr. Safa because of your hard work and you're so considerate and so I have no words to say because I missed the congrats meal. That's why I just want to say my gratitude because of your hard work only we are here now. So
Thank you.
I have some problems, ma'am. That's why I'm not taking the May one. So I want to discuss my problems with you. Can I call you later?
Sure, please. Just
Yes.
drop
Okay.
it in the
So I'm
comment.
aiming for, yeah.
Yes.
That's why I'm aiming for the November one. So do we have any online session so that we can do that from our center, home center?
I didn't get that.
Online exam.
No, Anjali, you won't get online. Indians won't get online option. It's only for those who traveling is an issue, like Sudanese, like Myanmar. Their traveling restrictions are there because of the borders or some internal problems in the country. So therefore, they are only there.
So in those cases also, we have to tell our what is the problem, and then they can allow in the same
You can
area.
write an email. Anjali, I can talk to you
Yeah.
about this. But I
Yes.
can guide you on this. Yeah.
Yes. Okay. And November mock exams, when will you conduct, ma'am? Which month?
It will be somewhere in October.
October.
Depending upon the exam dates of course of the college, then we will announce the mock exam date.
Okay. So if we want to take exam at two center for the mock, then in India somewhere, and then in suppose Abu Dhabi or somewhere.
We will take.
So there will be the time difference, no? So that we can travel and we can book.
Definitely. UAE always I keep one day before exam. So everybody reaches out. That's why my UAE registrations are very higher. I always keep like one day before exam. So everybody reaches out to me.
Okay. And ma'am, you do the Singapore mock also?
So I've not started as of now, but if the request would be there, I might consider. This time I'm doing Malaysia.
Okay.
So I'll add on to that. Okay. Depending upon that, how many of you could get the booking.
Okay, ma'am.
Okay. Thank you so much.
So how many, what is the schedule for November batch when we will book? It is starting from the 1st of March, right?
So it is starting. Already people have registered. The schedule would be given there and you'll start sooner.
Okay. So it will be every week we have to present or means just some guidance, ma'am?
No, daily, Anjali, you will present in the group for the moderator. You will meet me after 3 weeks generally for the November batch because we have to be slower to make a pace up.
Okay.
All right.
Okay, ma'am.
All right. Any question?
Ma'am, could you please tell about the intense mock course, or is it needed over the regular and fast track course?
Intense mock is almost like 1-to-1 because we have got only 4 students there. The ones who don't have any financial limitation can do that, but it's expensive because it's going to be more of a presentation. So if you people want to do intense mock, you can definitely take that. But it's like,
Ma'am, but it will be too early for them. Actually, this
you
intense
guys are
mock,
not ready for the
salvation course
intense
and
mock
all.
at the moment, guys. You're not
Yeah,
ready.
because
We don't know the
that
basis at
is
the
that
moment.
is for presentation. You have to present. We are not going to teach anything. We will be giving only feedback. Teaching will be mostly with with ma'am only. Okay, in regular course and the fast track. You
Nobody
can
is-
join this intense mock only after your regular course is over.
Nobody is going to teach you. I don't even teach myself in fast track. I don't teach. In fast track, I make sure that you know how to present and then I polish. Teaching is only in regular course. And that is especially for the newcomers, everybody. I have to make your basis very strong because I take it from the 0 step. After that, we assume that fast track people, they know the content. I don't assume that fast track is a starter student. Do you get what I mean? I don't expect.
Yes, ma'am.
Similarly, in intense mock, somebody who only knows it, then only they can take the intense. So after assessing you, I'll be in a better position. Give me 2 modules, please. I'll see
Sure,
you.
ma'am. Sure. Understood, ma'am.
After 2 modules, I'll be in a position that how you guys are doing, how much effort is needed. Do you need more polishing? Are you okay with these 2 courses you'll be doing with the regular and the fast track and 1 mock? I'll pen down everything and I'll show your results to you guys. So give me at least 2 modules to assess you guys. Okay, your 2 presentations. So that I'm in a position to guide you guys at where you guys are lacking or what are those things where we need. All right.
Okay, ma'am. Understood. Understood.
So much. Thank you. All right, guys. Thank you so much. So I hope the queries are clear. The ones who couldn't join, please, I'm going to post in this recording and that the link, Safa, we will give to them so that they can book up further. If any questions are there, if I'm getting back to you guys a little late, please, I'm trying my best to cover up as many messages, but then one live session I take and then again 100 messages, they start coming up. So I hope that I'll be able to complete that today. I have to take oncology 1 session for the July 2025 batch as well. So if you guys remember the same CIN, yes, the same cervical cancer and the endometrial cancer. So I'm happy that you guys are 1 step forward now. I'm so glad, but the efforts have to continue because what I want is that in this one go, you get over with this Mrcog. May that be May 25 or November 25, but I'm giving you time of 2025 only. 2025, you all have to complete your Mrcog. If you're starting for May, just stick to me. Just don't leave any day without getting connected to me. Just catch me wherever I am and keep me posted for what you're doing so that I can have a focused attention on you guys. And if you're going for November, even then, please, you are going for November because you want more time. So don't lose this time. This time is very precious. You have to clear in November. I'm sure that you all would do that. Thank you so much. I love you all. Take very good care of yourself. Another step, one step for me. You all would do great. Yes, there's somebody who wants to speak, please.
Hello, ma'am.
Hello.
Ma'am, which module will be done tomorrow?
So I'll post in the group the schedule, my dear. Just now. Safa, please make sure that they have 110 batch.
Ma'am, tomorrow actually this 1111 we are doing teaching.
You have
So
to put
these
1111.
people 1112 will be joining as a listener. Okay, but
Tomorrow
we will
are
start
giving
with the
the
guiding.
easiest module and which is teaching. You will observe them how to teach, how to do that. Teaching is the easiest module where you get 90% score. And Safa, share with them the PDF of teaching so that they know that this PDF they have to cram up. Okay. And then after that, it would be Gynac for you guys, which you will start with the moderator. Okay.
Okay.
Thank you so much. Thank you. Take very good care, everybody. Thank you very much, Safa. Thank you, Shabnam. Thank you very much to all my lovely students out there. See you guys in the study group for May or November. Take it a start now before we just get stressed up by being late. So your daily schedule, plan them so that you're focused and you're in the right direction from the start. Thank you very much. I love you all. Let's make another success together. Thank you so much. Bye-bye, everybody. Take good care. Thank you so much. See you guys soon. Thank you. Bye-bye.